More than 3.5 million eligible voters in Ontario are over the age of 60. That's a significant number of people who are still very active and living independently, each with a lot of experience and know exactly what they want from the individual parties in this election. Colleen Mckay and her husband have been retired for 8 years now, spending their time in their apartment in the east end of Toronto, occasionally joining friends in a local seniors group for a game of euchre. That's where she spends her time chatting with others about what means most to them.
What I'm looking for is help for seniors who, at the age of 65, retire from work and now they do not have any coverage for vision. There's no dental coverage, and we can't afford it. You're on Canada pension, old age pension. You're restricted at what you can do.
CARP, or the Canadian Association of Retired Persons, has 200,000 members and 95% of them vote. So it's put together a list of critical priorities for seniors during this Ontario election, all of which are related to health in one form or another.
The number one issue is drastically reducing wait times. Everyone is experiencing the hallway medicine, the hours-long waits in ERs, and then weeks or months to see a specialist if you're referred to a specialist, can't find family doctors. The wait time is actually a crisis in Ontario healthcare.
Among the other key issues are long-term and at-home care. Funding for more personal support workers is key, CARP says, so people can age in their own space. It could also mean changing the way people are cared for in long-term settings, so there's more emotional and individual responses. Then there's the matter of trying to be more proactive in providing quality care.
We know that older Canadians want to be engaged in their own health, in preventative measures, and funding fitness is a great way to cut healthcare costs, to reduce the acute care in diabetes and obesity and all the things that come along with aging.
Doug Ford's Conservatives did announce an at-home tax credit for medical expenses during their pre-election budget. In addition to health care promises, the NDP said it would allow for property tax rebates for those 55 and older, while the Liberals have promised to top up federal old age security benefits. Colleen, meanwhile, says she's not hearing any of it, and she's disappointed.
My hope is that somebody will listen. One of these politicians to listen and say, you know, that might be a good idea to spread it around a little more.
Other advocacy groups have brought up issues affecting seniors as well, including better protecting retirement savings and pensions, and also assisting with people who are victims of elder abuse and training for those who are caring for them as well. Mark McAllister, City News.